So this is an OPA. It's used in patients that are in danger of occluding their airway through things like their tongue rolling back. To size up an OPA, measure from the corner of the mouth through to the end of the mandible. So this is the correct size. To insert an OPA, insert it face up, halfway, rotate 180 degrees, and just should sit nice and easy. And this is a NPA, or nasal pharyngeal airway. This is used in the event that a oropharyngeal airway cannot be used through things like trismus or perhaps a broken jaw. To size up a NPA, you measure from the base of the nostril through to the tip of the earlobe. So this one's the correct size. Before putting it in, you want to lube it up. So I'll lube that up quickly. And then you want to tilt the patient's head back, select the largest nostril, and following the curve of the airway, insert into the airway, right down through the base. The implications of an OPA is potential damage to teeth or the inside of the mouth if you size up incorrectly, potential for a gag reflex or stimulation of the vagus nerve and in turn bradycardia through the same of incorrect length selection. The implications of a NPA are damage to the nasal cavity through, again, incorrect sizing or through incorrect technique or forcing it through the cavity. This is an adult bag valve mask. It's used for patients that are struggling to breathe on their own, have a GCS of less than 8, or are unconscious. To use the bag valve mask for manual breathing, so breathing for the patient, we would use a CE grip, place it over the mouth, ensuring a good seal, lift the chin, and squeeze the bag for a third of the way, looking for chest rise. Yep, I can see chest rise, which indicates oxygen getting into the lungs. If the bag valve mask was connected to an air tube, like so, we would use a 2-hand grip. So placed over the patient like so, under the mouth, and the flow rate for this particular bag valve mask would be 10 to 15 liters per minute. And if we were manually breathing, we would be doing 1 squeeze every 6 to 8 seconds. The complications of using a bag valve mask are gastric inflation, damage to the alveoli or lungs through hyperinflation from squeezing the bag for more than a third of the bag. To assess a patient for a difficult airway, in which we would not use a bag valve mask, we use the MOANS acronym, which is patients with mustaches or facial hair, which will impede the seal around the mouth, patients over the age of 55 years of age, also patients who are obese or pregnant, patients with no teeth or dentures, and patients suffering from symptoms like sleep apnea, stiff lung, or COPD. So here we have the MRX HeartStart LifePak 12. I'll just go over the components of it quickly. In the left-hand pocket, you'll find the 3-lead and adapter, the SpO2 sensor, the end-tidal CO2 sensor, and the blood pressure cuff, non-invasive blood pressure cuff. In the right-hand pocket, you will find a 7 or a 12-lead adapter, a test load and the test load adapter, and the electronic CPR device. You will also find a package containing a razor, aspirin, and GTN. And then in the back, there's a little package containing spare paper and batteries and ECG dots. So to test the machine and to test if everything's working correctly, first off, ensure that the test load is connected. Turn the monitor onto monitor. Wait for it to load. And once it's loaded, enter the menu. Go down to Other, and then into the Operational Check, Run Operational Check, and Acknowledge, and wait for it to test. And the next prompt will tell us to charge, so press charge, and press shock.
Shock delivered.
And acknowledge the voice command. And then it says the machine will run through the rest of the testing. Once testing is complete, it will print out a form saying that the machine has passed or failed. So I will now demonstrate how to obtain an ECG. So first off, we will place 3 dots, one on the left arm, one on the right arm, and one on the left leg. Take the 3 lead out of the monitor and attach the leads, like so. So left leg, left arm, and right arm. I'll then turn the monitor onto monitor, and the ECG will now be displayed on screen. So during observations, to change the volume, just enter the menu, head to volume, head to QRS, and adjust to desired volume. To change the selected wave, there's a button on the side, and press the wave to select wave 1, 2, 3, or whichever wave you want to select. To select the wave size, enter menu, go down to displayed waves, enter, select the wave you wish to view, so for me it'll be wave 1, select pads, and select the desired size. I will now demonstrate how to turn the LifePack 12 into an AED, and then how to manually defibrillate and disarm the charge. So to turn it to AED mode, I just turn the dial to AED and await instructions.
Analyzing heart rhythm. Do not touch the patient. No shock advised. Pause. If needed, begin CPR.
Yep. And so then I'll just follow the instructions and begin CPR if needed. And now to charge it to manual defibrillation, I will dial it up to 150 joules. For the purpose of this video, I will use a test load. So take out the test load, press charge, and press shock to deliver the shock. To disarm the charge it up, and press the disarm button. This is the St. John First Response Kit, and I'll just go over it quickly. In the top pouch we have our diagnostics, so that's like the blood pressure cuffs, the glucose monitor, stethoscopes, and that sort of thing. In the bottom we have our PPE and fluid management, so that's like the fluid bags. In the top right hand pouch we have our emesis bags, safety glasses, and the cold spray, as well as the spinal assessment lanyard. In the bottom pouch here we have the glucose management, so in here's the glucose bag, glucagon, and sugar sachets. In the right pouch closest to me, so the big one here, is the hemorrhaging management, so that's your tourniquets, your bandages, and your gauze. In the main pouch at the top, so in the top pouch here we have our pain medications, so that's things like ibuprofen, Panadol. The next pouch down is your airway management, so in here will be your OPAs, NPAs, lubrication, and a laryngoscope. And the next one is your airway masks, so your nebulizer masks and your breathing medication. So that'll be salbutamol, ipratropium bromide, and your adrenaline. In the main pouch you have your sharps container, your slippery SAM, your fluid lines for IV bags. I've got your pediatric bag valve mask, your adult bag valve mask. I've got your LMA bag and your IV kit. You've also got a towel, cardboard for splinting, and a neck brace. This is the suction unit found in the back of the ambulance. To test the suction unit, first you want to unravel the tubing and inspect for any damages, so tears or holes. There are none that I can find. To test the suction unit, place a kink in the hose, hold down the test button, and turn it on to max. The machine will run through the testing, indicating pressure buildup and battery level. Once the test is complete, the machine will shut off. Yep, like so. And to suction the patient, you will have them lying supine on their back and turn their head laterally. You'll want to inspect for any large chunks. If there are any, a finger sweep will be suffice to remove them. To suction, turn the machine onto full and insert into the mouth, like so. To suction, block the hole and moving in a circular motion outwards for no more than 10 seconds. The possible complications of using a suctioning machine are the stimulation of the vagus nerve. If you go in too deep, you should not go deeper than you can see, and using a rigid catheter in a moving ambulance is not advised. This is an oxygen bottle, and this is the control valve that controls the oxygen flow out of the bottle. For the purpose of this video, the bottle is empty, but I will pretend it is full. So this is the regulator that attaches to the bottle. To check the Botox seal, you just flip the Botox seal in and out. Botox seal should be checked regularly and ensures a good flow of oxygen out of the bottle. To attach the regulator, align the two prongs here with the two pins here, like so. And once it's aligned, screw the bottle in just hand tight and open the bottle. The needle should come up to approximately 2000 psi, indicating a full bottle. And to attach a mask to a patient, you would attach the tubing to the nozzle here, take the mask, place it over the patient's head like so, and then select an appropriate flow rate. For this video, I will choose a flow rate of approximately 8 to 10. So you just adjust the flow rate and it'll flow out. Once the oxygen is complete, close the valve, remove the mask, and remove the tubing, like so. To bleed the regulator, close the valve, open up the flow valve until all oxygen has been removed.